In studio with us this morning, I have Dr. Rhea Corbin-Harte. Good morning.
Good morning.
Did I get it correct?
You did.
Lovely, Dr. Rhea Corbin-Harte. And a very familiar voice, of course, Mr. Shane Seeley. He is the corporate communications for the Queen Elizabeth Hospital, and he's here with us this morning. They will be joining us each Monday at 11 a.m. To discuss a couple of things and to make sure that we not only feel the pulse of the QEH, but recognize that the QEH is with us and actively with us in our everyday environment. Good morning to you, Shane. Welcome.
Thank you so much, Kimberly, for welcoming us to what is now our home, the QEH Pulse Radio Show. It's so good to be on Q and so good to connect with your listeners, which coincidentally, many of them are our customers, our clients, our patients, our family.
Yes.
Because at the end of the day, the QEH is our hospital, and we want to really connect with the public through Q to give them all the information they will need to know about the Queen Elizabeth Hospital, its services, and how you can better utilize the QEH to meet your demands as far as health is concerned, because it's all about better health. That's what we're promoting. The QEH is the lone tertiary healthcare institution in Barbados. It has been serving thousands of Barbadians year in, year out. Daily, we see so many people coming through our doors, and this is just another avenue to serve our public. I'm Shane Seeley, Communications Specialist with the QEH. Of course, I'm joined by my colleague, Dr. Rhea Corbin-Harte, who is the manager of the Patient Relations Department. And today's topic is the QEH Services You. So it's all about accessing a number of our services. We have a number of new services as well, more recent services, I should say, like the Patient Advice and Liaison Service, which is headed by our Dr. Rhea Corbin-Harte. We have so many other services, and you'll get to hear from another lead on the medication delivery service as well. And there are so many ways that you can connect with us, and you'll find out all about them right here. Dr. Corbin-Harte, it's so good to be alongside you in this format.
And also this our first radio show for Barbados and wider, because I know that persons tune in with the internet nowadays. So I'm very happy to be here to share the information we have to give. Persons are probably wondering, how did this come about?
Indeed.
As patient relations manager, the Patient Relations Department is here to assist persons in navigating the hospital system. Persons may have questions, queries, things they don't understand, where to go, etc. And that is what the different subunits of the Patient Relations Department are here for. And there are questions that persons tend to ask frequently. You know, we speak about FAQs, frequently asked questions. And there are things that are also frequently misunderstood.
Indeed.
So together, as you know, we sat down and said this would be a great forum to be able to address some of those usually asked queries and questions and the things that persons don't understand.
And misconceptions.
And misconceptions, yes. So persons would have more realistic expectations and would be more comfortable with our services. And also, there are a lot of services we have that persons actually don't know about. I myself didn't know about some until I came into this role, even though I have been a doctor for more than a decade.
Wow.
I'm still young though. Yes, but the hospital has a myriad of services for sure that are here for the public and those beyond.
And it's right that we start with that one that you hold responsibility for,
yes,
which is the Patient Advice and Liaison Service. So it sounds like a mouthful when you first say it, but it's really PALS.
It's PALS.
And we have really branded it as your hospital PAL.
Yes.
So I know people would have seen and heard and talked about those communications that would have been sent from my communications directorate, coming to the accident and emergency department.
Correct.
When we had those surges. And I would encourage people advice and liaison service for a number of reasons, and
Multiple.
and you can explain why.
Sure. So first of all, I'm going to share the telephone number 536-4800. It has a nice ring to it. 536-4800. And as you said, this is the patient advice and liaison service. So it is a portal for persons to receive advice and answers to their questions and queries, and it also acts as a liaison between other departments within the hospital and the patient or the public or the relative, whoever may be calling. It is a hotline that is manned by medical staff, so doctors and nurses, and it operates daily from 9 a.m. to 9 p.m. except public holidays at this time. What can you call this hotline for? I know that's the burning question. You can call this hotline.
I would say everything.
Exactly, I was going to say for anything that you're querying about to do with healthcare and to do with the Queen Elizabeth Hospital. So some examples: persons may want to call to find out what are the visiting hours for the particular ward they are going to. Persons may want to call to find out, what should I bring with me to the hospital? I'm being admitted tomorrow for surgery the following day. What should I bring? Persons may call because they cannot recall the date of their clinic appointment. You can call about absolutely anything. We even get calls and emails from persons who are interested in coming to the hospital either to work or to do observerships in terms of students from overseas, etc. So that just is a snippet of what persons can call about. With regard to accident and emergency, as you mentioned, the hotline can be used as a resource to get a bit of medical information or advice. So sometimes something may happen at home, it's scaring you, you're worried, understandably, and you're wondering, is this something that I need to go to the A&E right now, or is this something that can wait until tomorrow, or is there something that I can do in the meantime until an ambulance comes? I always remember when I was a child, my mother does not let me forget this. I was staying with my grandmother, and she fell off the commode. The older persons would know what that is, and she got a cut on her foot, and it was bleeding.
No, you can't go. What is the commode? I don't know what commode is.
You're young, yes. The commode.
There's a hammock.
No, Shane. The commode is the convenient bathroom within your bedroom.
Okay.
So you literally just move from the bed and just kind of shimmy over onto the convenient. It usually is wooden. It has a bucket, and they will empty it in the morning, and it's helpful for people who can't walk well.
This program is so important. The education is very broad.
Education is extremely broad.
Commode. She fell off of the commode.
Exactly. So she fell off the commode and she cut her foot, and it was bleeding a lot. And I don't remember how old I was, but I was definitely under 16, and my mom was overseas, and I called the ambulance number to find out what to do with this cut. And they were able to tell me, apply pressure, keep applying pressure, don't move it to look, keep the pressure on, and if it doesn't stop bleeding, then you will need to call us back because she may need to come to the accident.
Is this what prompted you to become Dr. Rhea Corbin-Harte?
I guess that's where I realized that I was not afraid of blood. Many persons are a bit squeamish, understandably.
Like myself.
So I gave that example to show that these are real life experiences that persons may be going through.
Yes.
And the patient advice and liaison service can give you advice on the spot at that time. They can reassure you on, what is going on with you, to help you to decipher, where should I go? Is this a polyclinic issue? Is this an A&E issue? Is this my GP issue? They can give you that kind of information and allay your fears as is necessary.
The common thing that comes up is that people say, I'm sick.
Yes.
I'm feeling bad for whatever reason. A lot of them have chronic diseases.
Yes.
And we know that NCDs are plaguing our society.
Yes.
Some may feel that they are suffering the symptoms of a heart attack.
Yes.
For instance, and these are very serious.
They are
things that can happen to us at any moment. And I say us, people that may be existing and living with those conditions.
Yes.
Now, people may say, how can I not come directly to A&E, or how can I make a phone call when I believe that I'm suffering the symptoms of a heart attack?
Understandable. So I would always err on the side of listening to your gut. We always speak about listening to your gut. if you believe that you are extremely ill, you should make preparations to seek medical attention. While you're waiting for transport, or if you're unsure about the decision, you can call the Patient Advice and Liaison Service. As you said, they're your hospital pals, and they can offer you support while you wait for your transport to arrive, or they can offer you advice on what you can do.
They can even call the ambulance if they need.
They can assist you with calling the ambulance, and just pretty much allay your fears. Sometimes persons call, and let's use the heart attack for example, and I must say though that the PALS desk is not to replace actually being seen by a doctor, right? That's very important in terms of a doctor actually seeing you, touching you, examining you, taking your blood pressure. We can't replace, but there are some things that we can give advice on. There was a case, I think it was back in 2021, where one of the PALS desk doctors, she actually talked a family member through CPR while they were waiting for the ambulance to arrive.
Wow.
So that is how helpful it can be. And in medicine, the earlier that CPR is started, the better the outcomes are for the patient.
Wonderful.
Yes. So advice, reassurance. If you're not sure, you call. If you're worried about something, you call your pal, your best pal. So that's what this is. The hospital, your hospital pal. They're here for you. They're medical persons, so they can help to answer medical questions. And again, the number is 536-4800.
536-4800. And
yes,
we are your hospital pal indeed, and that's why we really started this Pulse radio show. And you can also call us and get your questions answered live on air. You can call us at 434-1007 or 434-1070. You can also WhatsApp us as well at 434-1007. That's 100.7. Don't put a point in between there when you're calling though. But yes, and we've also really, we thought this was an opportunity for us to engage on a number of levels. I know people, and I raised the point about accident and emergency deliberately because we are also going to, every Monday, give you a report on what the situation is like in accident and emergency. You've heard about the surges. What you have not heard is that since we've expanded, we've been able to really get a handle on things, and service delivery is improving. Accident and emergency, the department is a work in progress, but let me assure you that our staff, our medical staff, our ancillary staff are working around the clock to ensure that we provide the best service possible. We'll be focusing a lot on accident and emergency next week as well, when we invite the head and consultant in A&E, Dr. Anne-Marie Cruikshank, to the program. So she will be on. That will be next week, a real focus on A&E. Today is the introduction about QEH and you, and really how you can access more of the services that we have in store there. So let's take a look at the AED status report.
Okay, so for the status report for today, Monday, June 3rd, for the last 24 hours, the staff in the accident and emergency would have seen 56 patients. And I'll expand a bit on what the word seen means. I don't want to preempt next week's episode, but I think this is important. Seen is all-encompassing. It is a lot. You're seen by a triage nurse, you're seen by a junior doctor, a senior doctor, a consultant, but ultimately seen, when we use the word seen, it means that you have spoken to the patient, examined the patient, looked at tests if necessary, and put everything together to try to figure out what is the diagnosis, or at least what are the 2 or 3 most likely diagnoses, because it's not always immediately obvious, and also started treatment to try to help the patient to feel better and to treat the actual illness. And these are the illest persons in Barbados are in the accident and emergency, or at QBH in general. And seeing a patient in A&E and seeing a patient in a GP's office can be quite different in terms of time. I myself have worked in the A&E, and I've spent sometimes half or more than half of my 8-hour shift on one patient, just setting up lines and IVs and treatments and reassessing. Some patients can take
I think you need to repeat that, Dr. Corbin-Harte. I think you need to repeat that. And we want to welcome some of our callers very shortly. But just to finish that point about seeing patients.
So yes, some patients can take very long to see because the word see means start treatments, and medicine is so advanced. Our QEH doctors are so advanced in their skills and knowledge that they work extremely long on one patient. So when we say 56 patients are seen in 24 hours,
Well,
you can understand. Some are shorter, but some are long.
let's go to the phone lines very quickly. We have our first caller to the Pulse Radio Show.
History.
It's really Baker. Welcome to the Pulse Radio Show. How can we help?
Okay, I have a question that it have been bothering me for a while. Good
Okay,
morning.
good morning.
Good morning.
And it may not be important to other people, but it's important to me. So I want to know, I know back in the day when somebody come to the hospital and they're admitted to the ward and that person can't feed themselves, there used to be nurses that come around and feed those people. Does that still exist?
I'll take that one, Shane. To the best of my knowledge, and I thank you for this being important to you, because we definitely want to make sure that everybody gets the care they need and everybody's not at the same level. So some persons will need assistance. As far as I recall, and I stand corrected, there is a group that started that back last year, 2023. To be able to assist persons. You also have nursing assistants on the wards and health aides as well that are there to help generally with nursing care, and persons who need assistance can get assistance in that way. And also, I mean, this call actually brings us to a topic I wanted to touch on today, is that the visiting hours period is strategically placed at lunchtime and also covering the dinner time, so that family members can also get involved, because part of the recovery process is, you know, interacting with your loved ones and those who you're accustomed to. So for true patient-centered care, it wouldn't just be the nurses helping a person, but also their relatives. So the visiting hours are strategically placed around those times that relatives too can get involved in feeding and bond with the person at that time as well. So there are many ways that the patients would get help if they are unable to feed themselves.
So, caller, what just doubling down on what Dr. Corbin-Harte is
Question, right?
saying.
The reason I'm asking this question is because it happened to my mom.
Okay. So,
My
can you
mom
explain the situation exactly as you remember it?
Okay.
About what happened to your
mom?
mom?
Was in the hospital. When I met her to the ward, I told them she was blind and she couldn't eat off of a plate.
Right.
She had to give her a bowl. She could feed herself, but you had to give her a bowl.
Right.
When I come into the hospital that day, I saw a lady, the lady that bring the food.
You remember what time you came?
That was, let me see, this is 24. I think it was in 2021 that it happened, but it stuck with me. Although my mother passed away, it still stuck with me.
Sorry to hear.
Right.
And I saw that lady take up my mother's food and put it in a bag, a plastic bag. The whole plate of food that she bring for my mother, she didn't eat that day. So I'm saying, if I didn't go that day to the hospital that day, she would never eat. Because I had bought food for her, so I let the lady go along with the food. But sometimes it still bothers me that I should ask her why she didn't feed her. Why she didn't feed her, because I think that she was that did that. That's what I'm thinking. And you know, I don't want this to happen to somebody else's mother.
Yes.
Can't help themselves.
Agreed.
You know what I'm saying?
So
That hurt.
right. So what I'll say to you is first, condolences on the passing of your mother, and this is what you're describing is not how we would want any of our patients to be treated. What happens is in situations like that, and especially if there's no next of kin, our nurses and nursing staff would definitely feed the patient. We can't speak exactly to what happened in your mother's case, and I'm so glad that you would have raised this issue. This, what you have right here, is a complaint, and there are ways to have your complaints answered at the Queen Elizabeth Hospital. So, for instance, in your case, if you had known that there is a critical risk department where you can make these complaints to and have them investigated and have the matter resolved in your favor, there wouldn't be a repeat of what you're saying, because then we would be in a position to know that this happened and we would be able to get on top of it.
I agree.
So it is so good that you can call and bring these problems to the fore, and that's what we want people to do. And that's why we created this program, so that people know the avenues that they have, the options that they have, and the power that they have to make us accountable at our hospital.
Yes.
So critical risk, that's the department you should have made that complaint to, and we will have our manager for that department on this program in a couple of weeks' time. And we will continue, myself and Dr. Corbin-Harte will continue to share these ways that complaints like yours will be heard and addressed in a timely manner.
Yes.
So really thank you for calling again. Our condolences, and we really hope that if any of your other family members and that you have to assist or come and visit at the hospital, we can promise you that if they're not treated in the way that you would like them treated, you would have an avenue for recourse in terms of making your complaint heard and addressed.
Thank you for having this program. It's a very good program. It just started, but it's good.
Thanks for the encouragement.
And we appreciate your call.
I've definitely written your concern down. As patient relations manager, this is something that hits true to home.
This is really what you...
This is what I do. This is exactly what I do. Sometimes I would think of these things myself. Sometimes other persons within the patient relations department raise these things to me. But they say many heads make better, and the more feedback we get, the more things I can make sure that I address. So thank you so much for the call, and I can definitely hear the passion in your voice. And thanks for the encouragement as well.
Bye-bye.
Yes.
Bye-bye.
So you got your weekly report on the AED. Things are, I would consider that moderate in AED right now, in accident. I say AED all the time, but it's accident and emergency department.
I didn't give the full report. I got into my story. I'm so sorry. It's 2 more lines.
Okay.
It wouldn't be long.
You might have to start over that report.
I'll start over. 56 patients were seen in the last 24 hours. I gave the full description of what seen means and encompasses. There are 15 patients waiting to be seen. Of course, that number can fluctuate. It depends on what's happening. And 27 persons were assigned to the wards in the last 24 hours. I want to get into further details. We'll talk about that next week to kind of break down what it all means.
Indeed. And I say sweet because it seems that things are being managed in the department. Patients are being seen in what it will be considered a timely manner. But
from the emergency room, yes.
Yes, patients being seen. I don't think people really understand it, and again, that's why this show is so important.
Yes, I can't wait till next week.
Yeah, when we talk about accident and emergency info, because I know that's what the public really wants to hear, and they would have heard our CEO really going into the improvements happening in accident and emergency department. But if you're coming into a department, first thing, you hear the keywords, accident and emergency. It is not a clinic. And I know people tend to sometimes get into using it in that way, because that's when you get into those category 4s and category 5s.
Yes.
And again, we'll break down all that jargon.
Hurricanes.
Yes.
Hurricane season, but we're not talking.
So those are the lesser injuries that we're talking about.
Yeah. Important, yes.
Important, but less complicated medical situations, which can be seen in a primary health care setting.
Yes. So next week I'll definitely expand on what primary health care is, and tertiary health care, and secondary health care. It's a lot of big phrases, but I'll be sure to break it down in a way that would be easy to understand. Yeah,
11:24 is our time. Let's welcome in one of those other services that we are going to be talking about today. That's why we have Trudy Griffith on the line. She is the lead for our medication delivery service, one of the success stories of the COVID-19 pandemic. We needed to find a way to get medication to people, and we continue that service, and it has been growing. Trudy, so good to talk to you this morning. I know you're very busy in the pharmacy at this time.
All right.
Trudy?
Can you hear me?
I can hear you loud and clear.
Can you hear me clearly?
Clearly, loud and clear. The rest of Barbados as well. So I was saying that, this is a success story of the COVID-19 pandemic. Maybe you can take us back a bit to the origins and why this service is now so important for the QEH and by extension our patients.
In 2020, we would have had a situation where COVID would have reached our shores, albeit for all of us as individuals, we did not know what we were dealing with, but then at an institutional level, we needed to mount a response. At the time, we didn't know what was going on, but we knew that we did not want it to spread widely among Barbadians, and we know that our pharmacy department is one of those departments that's quite busy in the hospital, and we wanted to make sure that persons did not contract COVID within the walls of the hospital. And therefore, I would have been approached in terms of developing a delivery service, which means that you did not need to come to the hospital to get your prescription filled or to get your repeat medication. You would have been provided with the opportunity to make a call to us, request the medications that you needed for us to deliver to you, and we would have processed that request, and those medications would have been delivered to you confidentially by an external provider.
Simple. And we have been doing that. Maybe you can give us an idea of what the demand has grown to be now, coming out of that whole COVID arena, and what we are seeing daily as more and more people demand what is an easier way to access their medication.
So this service is provided to all persons who currently see doctors within your hospital. So it may be you personally, it may be a relative of yours, it may even be a child who is currently receiving care. Anyone who comes to the hospital can have their medication delivered. In the beginning, the demand was quite high. However, when the hospital experienced the cybersecurity incident, we were unable to offer the service at that time, but we restarted once everything was back on track. So we are currently offering between 1,000 and 1,500 deliveries every month, and that comes at a cost, but it is a cost which is affordable.
A nominal cost.
A nominal cost. It is quite affordable, and that is one flat rate island-wide. So it does not matter if you live in Pike Corner in St. Lucie or East Point in St. Philip, your medication can be delivered to you safely and securely.
Okay, so talk about the cost. When we say cost, not even $15, $16?
So we have two providers, and obviously they have their own rates. We utilize hopscotch delivery, and they offer a flat rate island-wide of 10 Barbados dollars. And the postal service also delivers for us, but that delivery fee is based on the size of the package.
Right, so just under 3 buses
at $10. So basically, there's no difference in terms of the rate between the two. You can have your medication delivered to you minimally for 10 Barbados dollars.
So what you're saying, Trudy, is that we can, and our elderly population especially, although many of them love to come to the pharmacy and sit down and have a chat with one another or with our pharmacists, to get advice or what have you, but they can also have the option to sit down in their gallery, have a nice lemonade
or Mobby,
not too sweet,
true,
and wait to that delivery comes to their door directly, or even at work as well, because I know that the delivery service goes to the workplace.
Yeah, we have a lot of adults who are taking care of their
it doesn't matter where you are, we will cater to your needs. So you can be at home, you can be at work, and we will deliver to you. Now, I know that Barbadians have questions because they're saying, but if I don't come to the pharmacy and I have a question, does that mean that I have nobody that I can talk to? We have a hotline which is available not just to take requests, but you can also call and ask questions about your medications, because we don't want to take that step away from you in terms of coming to the hospital and being able to ask questions. But if you are receiving a delivery, that is no longer an option available to you. That has always been available to you, that you can call our delivery hotline. You can even utilize our hospital's website, and you can ask questions about your medication or about your delivery.
Right. Give them that number to call, Trudy.
The number is 536-4804. Let me repeat that. 536-4804. Only Monday through Friday between the hours of 9 a.m. and 3 p.m. If you call outside of those hours, or you call Saturdays, Sundays, and public holidays, unfortunately, no one is going to be there to answer you.
But can you leave a message?
Of course you can leave a message. Once you leave a message, we are obligated to call you back. I know that there are Barbadians who don't believe that, and they will call repeatedly until somebody answers. But the fact of the matter is, if you leave a message with your name and a number so that we can contact you, you will get a call back.
Trudy, thank you so much. And I can also say that you can also call the PALS help desk, and they can direct you to all of that information which Trudy Griffith, our lead on the medication delivery service, has just given you. Trudy, I know you have a busy day there in the pharmacy.
I do have a quick question for Trudy.
Of course, go ahead, Dr. Corbin-Harte.
Trudy, can your hotline accept WhatsApp calls? I know sometimes persons may not have credit on their phone, or they may not even have a landline. So can your hotline access WhatsApp calls?
It currently cannot access WhatsApp calls, but that is certainly something that we can do going forward. We can explore the option going forward. If persons can go on their mobile devices and they have a Wi-Fi connection, they can go on the hospital's website and they can contact us through that platform as well. And they can also call the hospital's PBX. If you can't remember the number that I gave you, because the number starts with a 5 and that is completely foreign to you, you can still call the hospital's PBX. That is 436-6450, and they will redirect your call to us.
Yes.
It's all about giving our patients options. Thank you, Trudy. Always good talking to you.
Absolutely welcome. Have a good day, everyone.
Thank you so much. And that good day for everyone goes out to all of you out there listening to the QEH Pulse radio show live on Q100.7 FM. We have another caller. Good morning. Welcome to the QEH Pulse radio show.
Good morning, Shane.
Good morning.
Good morning.
Morning, and your guest.
Dr. Corbin-Harte, she's the co-host.
Yeah. Listen, tell me something. Is there, I know at one point in time that when I go to the hospital, I actually work at the hospital as well, but they used to have like signs indicating if a patient has a disability. Do they still do that? Because a few years ago, I had encountered a situation where the patient was blind. The food was put there, the tea was put there, the patient could not get to it, and the bird went into the tea.
Wow.
And then the patient had to end up drinking that same tea. So I am wondering if there's a case where you can, and where you should have signs on the bed stating if a patient is blind, that at least if the nurse is busy and cannot assist the patient, that if somebody else might be able to come and say, well, let me hand the patient the tea because she can't see it, she don't know, she can't have herself that is concerned. So I was want to know that if there is still that in progress.
I can answer that for you. So what I would say is that there are many ways that things are done. Our nurses do something called a handover, where they would appraise each other of important things for each of the patients on the ward. Sometimes signs are used as well, but our nursing staff would know who would need assistance. One of the things that we definitely, our kitchen does as well, is that the drinks come, we have QEH juices, they come sealed, pre-sealed, so as to prevent occurrences like that with the bird you said that had happened. And the food is also always covered as well. So
that they're using the food and then using covers, but
yes,
at one stage it wasn't like that.
right. So
the food was open and the tea was open.
Exactly.
Yeah. And
So
the bird went
definitely
into the tea, and the lady didn't know.
she didn't know. So that's one of the things.
Tell about, don't give her that tea because the bird went into it. It
Right.
was there for a while. The tea got cold. Nobody to hand it to her, and
Yes.
she ended up drinking tea that the bird went in.
Wow.
Yeah, so we're always looking for ways to improve our hospital infection prevention and control department, in conjunction with our nursing department, in conjunction with the kitchen department, and I'm not sure whichever other departments, but we all work together, would have in the recent past, or not so recent past, made sure that all of our meals are delivered covered, and that our juices are in the cup. They're actually quite cute, I might add. I kind of wish I was getting a juice on a daily basis, but it's sealed so as to preserve the contents inside, and the nurses make sure that each other are all appraised of what's happening with the patients.
And caller, to your point, before we go to the next caller, as Dr. Corbin-Harte said, you said that would have happened a few years back. We are making improvements
Every day.
gradual improvements every day, so that patients are at the focus of whatever we do. We heard our CEO and our COO, Dr. Christine Greenidge. I got to shout her out for sure, because she is one of the brainchilds behind this radio program.
Yes.
But just to say that there are gradual improvements that are being made at the hospital to make sure that the patient is at the focus. So you mentioned IPC, Rhea, infection prevention and control. They actually have signs that they're put by the bedside for a number of reasons, and that would be included in their signage as well. I'm actually tasked with getting
more
them
signs.
more signs, which is a budgetary consideration that I have to measure and manage, but all of that to say that these improvements are being done with the patients in mind to address situations like what you would have just mentioned happened in the past, but going forward, because the meals, as Dr. Corbin-Harte said, are covered now, the cups are covered, there are better receptacles being used to protect the food and the tea and what's not. Those situations should definitely be minimized, if not brought to a complete end.
Zero. Yeah. Thank you so much for the call.
Yes, and signage. At least if the nurse is busy, somebody would be able to help the patient. Well, if the patient is blind from somebody, that body needs help.
So I was there from July 10th last year. So signage is definitely one thing that is high on the agenda, and we really thank you for the call. We appreciate that. You are with us on the QEH Pulse radio show. We have another caller on the line. Welcome, caller. How are you doing this morning?
Yeah, all is well, thanks. Well, you're more than gracious for blessing me with your presence. You're more than merciful, because all the blessings come from you. Because through job, blessed, no man cursed, loved by your family and thanked by your friends. Well, I want to thank the QEH for their 60 years of service. I really want to give congratulations, felicitations, and commendations on their wonderful participation to this country in terms of critical health care and mental health care, and all the, even the spiritual care that we need to get from the hospital at this time. Thank you very much. I have 3 questions, Shane. Thank the production team for taking my call. Good morning, Dr. Hart, as well.
Good morning.
Don't know if you remember me from past programs. Anyhow, my first question has to do with the increased cooling that the hospital would need for a service in terms of climate change, and the increasing temperatures in terms of outside, and the heat, in terms of decreasing heat illness in the hospital overall, not only the QEH but the the psychiatric hospital, but not only that, the polyclinics as well.
So let me answer that one time. You could shoot me the questions and I will answer them as they come.
Well done. Thank you very much.
So, for instance, to deal with the cooling and making sure that our patients are comfortable.
Indeed. Thank you very much, sir.
Well, we have increased the number of fans right across the hospital.
Well done. Thank you very much.
As far as the ACs are concerned, I remember as we were leaving the hospital this morning, they were servicing two by the private entrance. And the big one, the accident and emergency department, you would remember that that was natural ventilation
in the
outer waiting area during COVID-19. The whole department, the entire expanded department, is now outfitted with a nice cool AC. Sometimes it may get too cold and we have to raise the temperature to make sure that everyone is comfortable in that outer waiting area, and also in AED. The engineering department is working on a number of AC projects across the hospital. You may come through one area in the corridors which may be a bit warm, and we have decided that we are going to put fans in there for the interim, so that patients are kept cool, visitors are kept cool, and we deal with those, as you mentioned, heat illnesses. We haven't been seeing many of them yet. Luckily, the rains have come and cooled things down a bit, and we needed it. It's not good for the cricket though, but we definitely need those showers for other things like our reservoirs, etc. But definitely that is one of the things that is a high priority for our team at the QEH, and the ACs are actively being worked on and are installed already and are working as they should. You wanted to add to that, Dr. Corbin-Harte?
Yes, from the medical aspect, in terms of managing the heat illnesses, the nurses and the doctors do something called input-output charting for those patients who may be at risk, and that is where they compare how much water the patient is passing out on a daily basis with how much IV fluid or fluids they're drinking, and you're able to see if there's a deficit in any given period and be able to increase the patient's intake as necessary. So that is a way that the medical side manages the excess heat, because once it's hotter, the patients are going to sweat more, which means they're going to lose more liquid and they will need more input. So when the doctors come around and the nurses come around and they're charting and adding up and subtracting and so on, they're literally calculating how much fluid should we give this patient over the next day. Yes, so that was his first question.
Next question.
Thanks very much for answering my question. Appreciate that. And thank you, Dr. Corbin-Harte.
You're welcome.
Yes, my second question before I go to my last one has to do with the aspect of the service of, you mentioned cricket, Mr. Seeley Shane, and that is very poised for my next question. Now, you have been able to give your Harrison Point facility to Cricket World Cup in terms of the reactivation of that facility, and I want to thank you very much for that. That's a brilliant move. Fantastic job. What about the decentralization though to as well to the polyclinics in terms of making them 24 hours to making all the polyclinics 24-hour services as well?
Well, that is under the auspices of the Ministry of Health. The QEH doesn't have a mandate or control over the polyclinics, so that is under the auspices of the wider Ministry of Health. But as far as Harrison's Point is concerned, you can keep tuned in, because we will talk a bit about that. Our Director of Engineering did a wonderful job really explaining what is happening up there, why we reactivated it, and to many of the comments, and I will deal with the comments on making it a hospital for the North.
Fantastic.
We'll do that shortly, but you can look up for more information on that Harrison's Point scenario. But polyclinics, there is a wider plan in terms of the polyclinics, and the Ministry of Health will speak to that, but the QEH doesn't govern the operations of polyclinics.
And his third question?
I thought we had a third question from that caller, but he's gone. Next caller, good morning still. Welcome to the QEH Pulse Radio Show. What's your question or comment? Welcome, caller. QEH Pulse Radio Show. What's your question? Please don't listen to your radio. Please only engage us through your device, whether mobile or landline. Okay, well, you'll have to go away from that caller. You need to, when you call in, try not to listen to the radio. Just talk to us through the phone, and we'll get all the information you need to you. So speaking about Harrison's Point, it was recently activated as a secondary facility for the QEH in case we see a surge in the number of patients, or if there are other situations that we have to manage. Of course, we're all a part, Barbados is a part of a global event, so we have to have that capacity as is necessary for a global event, which is T20 Cricket World Cup. So I want you to take a listen to our Director of Engineering, Paula Agbuwu, let me pronounce that appropriately, correctly, who has been the lead on the re-establishment and the re-energization and reactivation of Harrison's Point.
The Ministry of Health, and by extension the Queen Elizabeth Hospital, has been tasked with the job to make sure that for T20 Cricket World Cup that we are ready for any eventuality. And by any eventuality, we mean that if there is an influx of infectious cases or a mass casualty incident, that the hospital is ready to accept those patients. As a result of that, the hospital saw the need for the reactivation of Harrison's Point, where if we become overwhelmed and we have more than 4 infectious cases which we can deal with at our Enmore facility, we will bring those patients up here to Harrison's Point. In this area right now where we're standing, we have prepared and outfitted it to be able to accept 20 patients, but this area can accept up to 38 patients. As it stands, we are ready for 20 additional infectious patients in what we call our primary A at Harrison's Point. We are also outfitting our tertiary facility, and in that building, we are going to be able to house between 90 to 110 patients. And that number is really based on the number of staff that we can accommodate during that Cricket World Cup period. We will have to obviously maybe if there is a serious event having multiple injuries and casualties, we will have to bring in staff, stop vacations and those kinds of things. And based on that, we figure that we can reasonably accommodate 90 to 100 patients within our tertiary facility. Our plan at the hospital is to have our most acute and our sickest patients at the Queen Elizabeth Hospital, and to decant the hospital and have our lesser acuity patients here at Harrison's Point. And the reason for doing that is because, as our medical teams have informed us, we have all of our ICU beds, our theaters, and all of those critical services at the Queen Elizabeth Hospital. Those are not replicated here at Harrison's Point, and therefore it is easier for us to make that extension for the critically ill patients at Queen Elizabeth Hospital and the less acuity patients at Harrison's Point. We have also outfitted our Ward A3 with an additional 8 beds in anticipation that if we have an influx and our main operating theaters become full, and by extension our recovery room, it means then that we will have an additional 8 beds that we can accommodate those patients to clear the theaters and have those patients recover on our Ward A3 to allow for additional surgeries to take place. So in all, the hospital stands ready, and our team, not just myself, but our entire executive team and the teams that fall under them, have been working hard to make sure that we as a team and as QEH, Team QEH, are ready to receive and accept any patients. Obviously, we're preparing for the worst and hoping for the best. We hope that we don't have to use it, but we are ready.
As our Director of Engineering there, Paula Agbuwu, said, preparing for the worst, but hoping for the best. It's all a part of building redundancies in our Queen Elizabeth Hospital to manage any sudden increase in patients, whether for mass casualty or for infectious disease. Many comments on those videos as we broadcast them widely across media and also on our social media platform. You can check it out on QEHconnect.com. It's also on Instagram as well. But it was aired on CBC this morning in Morning Barbados, aired in across media outlets. I can tell you, people from the north have been asking, why can't this be a hospital for people living in the north of the island? Harrison's Point is not an ideal structure for a hospital. It is not ideal for a hospital. It was purpose built to deal with infectious disease, in that time COVID-19, and it has been re-established as a redundancy for the QEH for Cricket World Cup. A hospital for the north, it will not be, and it was not built for that. It's too fragmented, too segmented. As you look at the QEH, you can see it's one structure, 3 floors. It's mammoth, it's huge. 2,500 staff there to serve you. But Harrison's Point, it is, and when you look at the video, we had some drone shots then, and you can see how fragmented it is. So the distance does not allow for an efficient use of what could be
patients move
a hospital, and patients,
they go downstairs for x-ray, ultrasound, they go to operating theater. Imagine the rain is falling and a patient needs urgent surgery.
We have another caller on the line to the QEH Pulse radio show, our first episode. Welcome, caller. What's your question or comment?
A blessed good morning to you, Andrea, and your team.
Good morning.
Good morning.
I want to say congratulations to you and the team. You're doing a fine job. I just want to make a suggestion.
Thank you. We appreciate it.
Right. I happened to be a patient last month at the hospital. An outpatient. I got into an accident and I was transported there. The assessment was quickly done. But I went to a room waiting to be seen, and I find that each time somebody come and call, a nurse come and call a name, that person is not there. But yet people are in this room waiting to be seen. So I started getting frustrated. But when I spoke to the doctor, she said there are 2 rooms. So I'm saying, if my name gone to one room, they should say, well, this person at room 1, the next person at room 2, and identify the 2 rooms that you don't look stupid, because if you come and say, Andrea, see, you know, and you are not there, but yet you are there to be seen, you get frustrated. You understand what I'm saying?
Indeed.
Yeah.
So just identify the 2 rooms. So he told me we're at room 1. So this is room 1. Andrea at room 2. So you go to room 2, you will find Andrew there, as opposed to coming to room 1 and he's not there, going to room 2 and he's there. That's all. I would say the service was good. When I was attended to, I was well attended to. The doctor was nice, cooperative, everything. But I just thought that I would mention that, thanks to bring up this program, to identify the 2 waiting rooms, that you will know exactly where this patient is. Let's see, who's doing the assessment, just slip at the corner, room 2, room 1. Identify the rooms, that's all I'll say. But other than that, I think you're doing a fine job, and I wish you and your team all the best.
Thank you very much, and suggestion taken.
Yes.
We will definitely have our team there in the outpatients department look into that matter and see how we can better streamline our services, because with your input, you are the patient, and if you see a way that we can improve our delivery of service to you, definitely.
Can let pals know.
You can let pals know.
536-4800. And we do accept WhatsApp calls. If persons are not able to make a regular call, we do accept WhatsApp calls. Unfortunately, not messages at this time.
Before we go to the next caller, I must mention quickly, CBC carried a story last night on ophthalmology with one of our consultants, actually the head of the department now, Dr. Trevor Drakes, I believe, speaking to some of the things that the ophthalmology department needs. More theater space, more nurses. And I know he's now recently come into the post, taking over from Mr. David Callender. We thank him for his service. Just to respond to that, to say, because coming into the post, a number of meetings still to be had. A number of the things that he would have asked for in terms of the operating space, more theater space, so that we can address those waiting times and the backlog in cataract cases and people looking for treatment for glaucoma, etc. These things are actively being dealt with at the highest level, by the Minister of Health. He has been looking into it, and as a part of the capital expenditure plan for the Queen Elizabeth Hospital. So you're going to see the Lions Eye Care Center being refurbished. A major part of that is dealing with the roof. So that is supposed to be dealt with, and that would allow us to then refurbish internally to create those additional theater spaces. All of these things are in train already. Active discussions have been had. The budget has been outlined to retrofit and address these problems. The engineering department is already looking at the scope of works, so you can expect in the very near future that you'll see more improvements in terms of the ophthalmology department and eye care here in Barbados. And by the way, ophthalmology has, in Barbados, we have the most specialists.
Yes.
We have the most specialists in the ophthalmology department anywhere, not only in Barbados, in the region.
In the region, all of the different subspecialties within ophthalmology. We don't even realize sometimes how many subspecialties there are within the specialty of ophthalmology. So definitely quite well staffed when it comes to the knowledge and the experience for eye care in the region.
And we got to thank the Ministry of Health for actively looking into the things that are needed there for us at the QEH, especially for ophthalmology, and it's good to hear that these things are going to be coming sooner rather than later. We have another caller as we get ready to wrap up things on this edition, the first episode of the QEH Pulse radio show. Good morning, caller. Welcome to the show. What's your question or comment?
Yeah, pleasant good morning to you, Shane.
Pleasant good morning to you.
And good morning to your company, Dr. Corbin.
Dr. Corbin-Harte.
Yes, please. Good morning.
Yes, please. I'm calling in connection with the dropped off medication. I want to congratulate that section of the hospital for the pharmacy hotline drop off medication. I'm one who gets my medication from that hotline business, and they are very efficient. They call me before they come to confirm, because sometimes most of the time I don't get them online, so I leave a message, and they call back to tell me when they are coming and what time to expect them. And when they are actually here, there's a call coming on the phone to let me know that the car is outside, so I can have my money ready to pay for it.
That's what you want.
Advise anybody, not only like myself that's vision impaired, but even if you are not, you should book in on this, because you don't have to catch the bus to go along there.
Yeah, you can save that bus fare.
Wait till the number come through. So the $10 that I would pay that, I would not put $10 top up on my phone. I would not go and buy a burger or ice cream or anything like that, because that would be more convenient to me for them to bring the drop for me.
Yeah.
So I want to congratulate them, Omar, Michael, and the team that is there in that facility.
We appreciate it.
For your
comments.
comments.
Next thing I must say, I went to get a blood test done, me and my son, last week. And it was so efficient. I can't believe how it was so efficient over there to get the blood test done. I want to congratulate Mr. Hope, the guy who does it. He does it on his own, by himself. He has no nurse, nobody moving around him to tell him, hand me this, hand me that, nothing at all like that. And he just does what he has to do, and we were out of there in quick time.
Listen,
he ain't making the sport.
Well, listen, we thank you for continuing to use the services of the Queen Elizabeth Hospital, and we thank you for your commendation this morning as we get ready to wrap up things on this radio show, the QEH Pulse radio show.
Thank you, and have a good day.
You have a blessed day as well. So as we wrap up things here,
gotta recap.
Yeah, we gotta recap. Of course, we would have. Which numbers do you want to recap, Rhea? Oh,
the telephone numbers that patients will need. So today we spoke about the hospital PAL, the QEH PALs, patient advice and liaison service. That's a big long phrase, but it really is your hospital PAL. Telephone number is 536-4800, and our
medication delivery service,
sister service, the medication delivery service,
the drop-off service,
the convenient drop-off service, according to our caller. That number is 536-4800. 804.
Yep.
These numbers do not replace our PBX. Our PBX is still the number you call if you want to be transferred to a department. Unfortunately, these numbers are not able to transfer you to departments, but our PBX is 436-6450. And I do have a quick tidbit, a bit of information. It's a fun fact. Our Queen Elizabeth Laboratory processes over 16,000 tests every single day.
16,000.
16,000.
Wow.
Tests daily. Sometimes we don't know what is being done, but they cover the polyclinics and so on. So that is the fun fact for today, and I thank everyone for joining us on this first episode.
Yes, look out for more episodes next week. It's all about the accident, your accident and emergency department, your AED, and how we can speed up those wait times to better serve you. We'll have Dr. Anne-Marie Cruikshank, the head and consultant in the department, to share more with you. Thanks for joining us on the QEH Pulse Radio Show. See you next Monday.
Thank you so very much, Shane Seeley, and of course, Dr. Rhea Corbin-Harte. We look forward to having yourself and Dr. Cruikshank next Monday, right here on Between Me and You, Q100.7 FM.